Thank you for joining me today. In this video, we are going to learn more about the psychiatric emergency. What are the psychiatric emergencies? Psychiatric emergencies are acute disturbances in thoughts, mood, behavior, social relationship that requires immediate assistance and intervention to prevent harm to the patient and others. So, psychiatric emergency are acute disturbance in a thought. Patient thought is disturbed. Mood is disturbed, behavior is disturbed, social relationship, or one of them, if one of them is present. Maybe their mood is disturbed, maybe their behavior is disturbed, maybe their thought is disturbed, maybe their social relationship is disturbed, and that requires immediate assessment and intervention is to prevent the harm to the patient and harm to others. Common psychiatric emergency include suicidal behavior, suicidal ideation, plan or attempt. If the patient is planning having if the patient having a suicidal ideation, plan or attempt, that is psychiatric emergency and they immediately has to be hospitalized. That requires urgent risk assessment and safety measures to prevent harm to the patient and to the others. So SI behavior, violent and aggression behavior is also one of them, and that can lead to risk of harm to self, staff, family, and other in the public. So second one is the violent and aggressive behavior. The third is acute psychosis. Acute psychosis is the patient is having a delusion, hallucination, severe thought disturbance. Their thought is disturbed severely, and they are having a hallucination, delusion, aggression, positive symptoms of psychosis. That's what they are having. And that may result in danger behavior or inability to care for themselves. The fourth one is the severe depression, especially when accompanied by suicidal thoughts, refusal to drink or eat, or psychosis features, because depression can cause psychosis, can cause psychotic features like hallucination and delusion. Severe depression can also cause suicidal ideation. Severe depression can also cause refusal to drink or eat, because some of the depression symptoms can be either loss of the appetite or increased appetite. Manic, the fifth one is manic excitement, excessive activity, manic excitement that leads to excessive activity poor judgment, aggression, impulsive, decrease of need to sleep, they are running to their death. That means they are running, they are not eating, they are not sleeping, they are not, it is too excited. Not excited that they are happy. That means they have a lot of energy and irritability and high excessive activity that they need to be hospitalized. 6.1 is the substance intoxication and withdrawal. For example, alcohol withdrawal can lead to delirium. That is medical emergency. Also, drug overdose can lead to death, and that is medical emergency, psychiatric emergency. Stimulant-induced psychosis, because stimulant medication can cause psychosis, and that is emergency. Panic attacks and severe anxiety state. It's also other psychiatric emergency that can lead to intensive fear, hypervigilant, chest pain, feeling of impending doom. So they are so anxious and so scared that they are feeling chest pain. Their heart is palpitating, that they are feeling the chest pain. So that is psychiatric emergency. Delirium, acute confusion state due to a medical condition, is also psychiatric emergency, because the delirium can lead to coma, and it caused by the medical condition is confusion that is emergency. First, you want to consider delirium. When you want to assist the delirium, when you are assisting the delirium, you want to consider the medical cause first, and then you want to consider psychiatric emergency. Catatonia. Catatonia is a most molesty, stubborn, ambassador, rigid, and extreme agitation. That causes extreme agitation. So it's medical emergency. Severe self-harm or deliberate poisoning. That's medical, that's psychiatric emergency that requires both medical stabilization and psychiatric evaluation. So initial management of these medical emergencies include ensure the safety of the patient and the others. That's what you want to first think about, the safety of the patient and safety of the others. Second, you want to assist the airway, ABC, airway, breathing, and circulation. You want to rule out a medical cause. You want to check if they have a low blood sugar, do they have a hair injury, do they have infection, are they intoxicated, are they having a low oxygen. You want to assist this medically. You want to rule out medical causes of the psychiatric emergency. And then you want to assist the risk of suicidal ideation, violence, and neglect, or self-harm. You want to also assist and use this de-escalation techniques first for the aggression patient. De-escalation, you want to talk to them through the aggression behavior. You don't want to agitate them more. You want to calm them more. You want to be their friend. You want to talk to them friendly voice, calming voice, reason with them so you can manage the situation. You want to, they need in emergency, so they have to admit to emergency medication when they need it. Like they also need administer a emergency medication when necessary, like benzo injection, psychiatric injection, and arrange urgent psychiatric consultant and appropriate admission if necessary. So psychiatric, you want to use the psychiatric emergency assessment, RAPID. RAPID is the abbreviation. RAPID is the risk to themselves and others, agitation and aggression, psychosis, intoxication and medical illness, delirium and depression. RAPID. Remember the RAPID. RAPID, psychiatric emergency assessment. Risk, aggression, agitation, psychosis, intoxication, illness. D is the delirium or depression. Serotonin syndrome is one of these medical emergency, and it caused by the excessive serotonin in the central nervous system and peripheral cortex. Why is these symptoms are happening? Because of the hyperplasia causes spinal serotonin overstimulation, causes that serotonin syndrome. Serotonin syndrome is a medical emergency. It causes hyperflexibility, overstimulation, aromatic instability, hypothalamus dysregulation that leads to hypothalamus dysregulation, and AMS, cortical dysfunction. Also, neuroleptic malignancy syndrome is a psychiatric emergency, and neuroleptic malignancy syndrome is caused by sudden dopamine blocker in the hypothalamus and basal ganglia collapse. When the dopamine is suddenly blocked, that leads to hypothalamus and basal ganglia collapse. And symptoms will be rigidity, hypertonia, and increased CK. So it's medical emergency. Also, lithium toxicity is it's medical emergency. It's caused by the accumulation of the lithium. renal accumulation of a lithium that leads to central nervous system toxicity. Progression, so this will lead to, first you will get the symptoms of GI upset, nausea, vomiting, diarrhea. That is the first thing you will see on the patient when they are having a lithium toxicity. Then that will go to next step will be tremors. The patient will be having a tremor. Then they will be confused. Then they will be having a seizure. So when you see a patient who is on lithium having a diarrhea, you have to stop the medication or lower the dose, because the gut is the first irritation in the gut. So lithium toxicity is irritate the stomach. So first the symptoms will be GI upset. Second symptoms will be tremor. Second symptom is GI will lead to these symptoms will lead to tremors, and if nothing happened or no prevention been taken, it can lead to confusion and no prevention. If no prevention was taken that time, that can lead to seizure. Thank you for joining me today. I would love to see you in my next video. Thank you. Please subscribe. Subscribe.